We live in a world that is moving forward rapidly. The digitized era is bringing knowledge to everyone's fingertips. We, as professional healthcare providers, need to adapt to the current era. Refined knowledge and clinical practice would ensure the best quality of care for our patients. The GMOA, as the largest collective of doctors in Sri Lanka, understands this and will strive to bridge the gap together with you, the academic subcommittee of the GMOA. No, we hope to cover from soft skills for a better care delivery to hands-on skills training. An array of training programs and sessions are planned. From basic life skills, personality development, to preparation for foreign medical practicing examinations and language assessment examinations, we hope to cover all your dire needs. Let's strive to be the most complete professionals in Sri Lanka. Together we can.
For traditional lighting of the oil lamp, I would like to invite following distinguished guests, Dr. Darshana Sirisena, GMOA President, Dr. Harita Alatke, Secretary GMOA, Dr. Chandana Dharmaratna, Executive Committee Focal Point for Academic Subcommittee of GMOA, Dr. Prasad Herath, Convener of Academic Subcommittee of GMOA, Dr. Prabhat Sugatadasa, Assistant Secretary of GMOA, Dr. Chamil Vijayasinghe, Assistant Editor of GMOA, Dr. AGCI Niroshan, Committee Member and representing the GMOA membership.
A very good morning to all of you. Welcome to the inaugural session of the GMOA Academic Subcommittee. Before starting the session, I would like to invite the GMOA Secretary, Dr. Harita Alatke, to the introductory remarks. Over to you, Dr. Harita.
Thank you, Charuni, and good morning. On behalf of the Executive Committee of the GMOA, I would like to welcome all those GMOA members who have joined through WebEx link to the inaugural session of Academic Power Program by our Academic Subcommittee, which was recently formed by the GMOA with the blessings of GM Executive Committee and the General Committee approved decision. As Academic Subcommittee of the GMOA, we have planned many activities for the future, including this Academic Hour program. And further to that, we have planned a hands-on skill training program at hospital level also. And this will be planned as a career development pathway in general, and especially with regard to the CPD aspect of the career development pathway. We have already discussed this with many partners, including the Ministry of Health, especially the ETNR unit of the Ministry of Health, several professional colleges, and organizations like SLMA, Sri Lanka Medical Association, how to conduct these programs in a better way for the future. On the other hand, we were able to incorporate many proposals into the recently declared budget speech by the government, especially with regard to the career development pathway of the doctors. And we were able to incorporate a proposal as a policy decision from the government to incorporate that 3 universities, namely Peradeniya, Ruhuna, that is Karapitiya Medical Faculty, and the Jaffna Medical Faculty, to award postgraduate qualifications to medical officers as a career development pathway. That the government has accepted our proposals and they have incorporated into the budget speech as a policy decision. Now that the first phase is clear, we are going to get it approved from the Ministry of Health, and we'll give the due recognition to the courses which will be designed by the individual medical faculties. That we will going to implement as an amendment to a medical service minute amendment in the future. We have already made the draft of the medical service minute amendment, and we are discussing with the Ministry of Health to proceed further. That will be a milestone or a remarkable achievement in the GMOA history, so that the apart from the Colombo PGIM, there are other medical faculties which will be recognized through award, especially the postgraduate certificates, postgraduate diplomas, even the MScs, as a career development pathway for medical officers. And that will benefit almost all the medical officers who are awaiting to get a postgraduate qualification with regard to their career development. And finally, on behalf of the Executive Committee, I would like to congratulate our newly established academic subcommittee and wish all the success for this program. Thank you.
Thank you very much, Dr. Harita. And next, I would like to invite President GMOA, Dr. Darshan Sirisena, for the inaugural address. Over to you, sir.
Good morning, everyone. Thank you, Charuni, for the kind introduction. I think today is a historic day for the GMOA, which starts its work in the academic subcommittee. Actually, academic subcommittee is a constitutionally formed one, which has been long due, I would say. So it is my pleasure at the outset to thank all the people who made this endeavor a success. So starting from the executive committee, Dr. Harita Lutge, the secretary, and all the vice presidents, the assistant secretaries, the editors, and the general committee who endorsed this proposal with no hesitation at all. So when it comes to the continuous professional education, as we all know as CPD, it's an evolving trend, not only here as globally. It is well established and evolving as we know. So when medical professionals are no exceptions, GMOA being the longest traditional professional body in this, not only in Sri Lanka, Southeast Asia, we have a responsibility to incorporate into the global trends. So that is the main objective of forming this academic subcommittee and continuing our work throughout. So as I mentioned, not only in the medical work that we are going to do, the academic subcommittee has formed a program which runs for the next 6 months for the moment, which has not only covers the medical subjects, but I'm sure things which are very important to a better doctor or ultimately a better human being to serve the patient. So I congratulate and wish you all the very best for a good academic program filled with academic activities as well as from the others. Thank you very much.